Hey guys, this is Dr. Michael Cuthbertson at Physio Fit. Have you ever been told that whenever your back is stiff or painful that you have a tight psoas? Well, today I'm going to address what the psoas is and what actually happens whenever it becomes a problem. So, as we look at the skeleton here, the anatomy of the psoas is such that it attaches to the spine all the way from your L5 up to your T12. It attaches at the L5 transverse process and then courses all the way up the spine to the T12 and even has fascial attachments, other soft tissue connections that go up to your T5, which is about up to this point in the spine. And so it expands a long range and it has big implications for our movements. Then from there it courses down in front of the pelvis all the way down to the femur, to this little point that we call the lesser trochanter. Whenever the psoas is working well, its primary function is as a hip flexor. So it moves our leg through this motion. It also has a really important function as a spinal stabilizer. So one of the things that it does is it helps to move our core or our spine toward our leg, among other functions. So when the psoas becomes problematic or dysfunctional, what's happening is that it's reacting to something that's going on in the spine. So as we look at the spine again here, if we have, say, like a bulging disc or degenerative discs, or if we have facet joint dysfunction, our facet joints are becoming a little bit arthritic, or if we've had some kind of compressive blow to the spine, or we've had excess torque introduced in the spine, more than it can tolerate, we have different receptors in the spine surrounding those joints that send a signal to our brain, and our brain gives an output that says we need to protect that segment that's become injured or that's become irritated. And so what does it do? It causes those psoas fibers at the particular segment that's been disrupted to tighten up, to become knotted up. Kind of like when you feel tension in your shoulders. You get a knot in your shoulders. That's exactly what happens in our spine at that exact segment that has become disrupted. And so if it lasts for a long time, or we let that injury go on for a long time, that muscle remains dysfunctional, it starts to stiffen up even more. It starts to become dehydrated. It starts to lose its extensibility, its ability to move properly, its ability to elongate. And so it becomes reactive again to the underlying injury. And it starts to create the pain cascade that we feel if it goes on for a long period of time. So the question is, how do we correctly treat the psoas? Well, I hardly ever recommend that we stretch the psoas. While you might get temporary relief from stretching it, the dysfunction that's underlying in the spine is going to drive that to come right back again, to create stiffness and pain in your back. So just as I talked about, when you get tension in the psoas due to the spinal injury, it tightens up, you get this knotted-like state in those tissues at the level of the spine. So we need to soften those muscles. We need to relax them, decrease the tension that's going on within them, improve that communication between the nervous system and your musculoskeletal system. And in fact, whenever you have an injury like this, those muscles tend to shut off. They don't provide that stabilization for your body and for your back. And so the next step that we need to do is we need to reinstate stabilization. That's done through specific core exercises. And then finally, we need to reinstate improved controlled motion into the body, and especially between the relationship of your back and your legs. Whenever that occurs, you get rid of that spinal stiffness. In combination, this approach can also help to decrease pain and help you to perform activities in your daily life with much better comfort. Thanks for following along today. I hope you've learned something about the psoas. And if you're looking to treat your psoas, check out my videos linked in the comments. They cover the same principles that we talked about for effectively treating the psoas to decrease tone, stabilize, and improve controlled motion. And remember, your potential is within reach.